Every morning, your body sends you a message about the water in your body, about sugar, about your blood pressure, about inflammation, and sometimes about the start of kidney problems. I'm Dr. Osama Ibrahim, a specialist in nephrology and hemodialysis. As a nephrologist, I can tell you that urinalysis is one of the oldest tests and most accurate warning systems in your body. Today, I'll tell you about 5 things your urine can reveal about your kidney health. In fact, some are simple and temporary, while others are signs that your kidneys are being harmed in silence. The danger is that many people see these signs over the years of their lives, and then they discover the problem too late. If you suffer from diabetes or high blood pressure, these signs could save your kidneys. Stay with me until the end of the video because sign number 5 is the most deceptive, as many people think it's just a normal urine smell. But in reality, it could be a very important warning. At the end of the video, I'll tell you about 2 very simple tests that are the first ones I request in my clinic for patients whenever I suspect there's a kidney problem. The first sign, and I'm starting with it because it's the most obvious, is foamy urine. Next time you go to the bathroom, look at the urine before you flush the toilet. If you see foam, is this foam thick? Are there many bubbles in the foam? Does it stay on the surface of the urine, or does this foam disappear? This foam is simply like soap suds, or like when you pour beer into a glass. And let me clarify a very important point here. Not every bit of foam in the urine means kidney disease. Sometimes, if the urine comes out with great force, or you've been holding it for a long time, or if you haven't drunk enough water, these bubbles might appear and disappear quickly. And this is usually not serious, but the foam that worries us is persistent foam. The foam that you see in your urine every morning, which stays on the water surface for a while and doesn't disappear quickly. Here, you must ask, is protein leaking into the urine? Before I answer that question, we made a special video about foamy urine, when it's something normal and when you need to worry and see a doctor. I highly recommend you watch it after this video. I'll leave a link to the video in the description or in the eye icon that'll appear above on the screen. Let's continue. We agreed that with foamy urine, you must ask yourself, has my kidney actually started leaking protein? Let me explain the matter simply. A healthy kidney works like a very smart filter, like a water filter. It allows waste and excess water to leave, but it prevents important things in your blood from escaping, like protein. Protein is supposed to stay in the blood because your body needs it for building muscle, for immunity, and also to keep fluids inside the blood vessels. But when the kidney's filters, which we call nephrons, get damaged, the kidney starts leaking protein, and it appears in the urine as bubbles or foam. We call this condition proteinuria, and it's one of the oldest signs of kidney damage, especially in patients with diabetes and high blood pressure. The problem is that this protein leakage doesn't cause any kind of pain, meaning you don't feel anything unusual when you go to the bathroom. It also doesn't cause side pain or any pain in the kidney area, but in tests, it shows up very early on. If you notice persistent, recurring foam every morning that doesn't go away, don't treat it as normal, especially if you have diabetes, high blood pressure, or a family history of kidney disease. Ask yourself this, have you noticed foamy urine lately? Go ahead and write your answer in the comments, yes or no. And also give this a like as it helps us spread the content. Now let's look at the second sign because it could be much more serious. The second sign is dark urine or tea-colored urine. Let me tell you a quick story. A patient named Michael, 62 years old. He came to me and said, "Doctor, my urine has been very dark for 2 weeks. I thought I just wasn't drinking enough water." And that's actually the first thing we think of in cases like this, dehydration. But after tests, unfortunately, we found his creatinine was very high and his GFR or glomerular filtration rate was low. The kidney wasn't functioning with the required efficiency. In here, it's important to distinguish between 2 things. If urine is dark after a long day, heavy sweating, intense exercise, or simply not drinking enough water that day, it might be normal, even if temporarily. But if the urine is consistently dark, even though you're drinking plenty of water, then we shouldn't be so easily reassured. When the kidneys can't efficiently get rid of waste and toxins in the blood, the urine becomes more concentrated and its color can also change. Sometimes dark urine is due to old blood in the urine, muscle issues after intense effort, certain medications, or liver problems. That's why I'm not saying every instance of dark urine means kidney failure, but I am saying that dark urine is an important message you shouldn't ignore. The simple rule is, if your urine is dark for 1 day and improves after drinking water, it's usually nothing serious. But if it persists for several days or is accompanied by pain, fever, extreme fatigue, yellowing of the eyes, or decreased urine output, then you must get checked out immediately. The third sign can be present even if the urine color is completely normal. The third sign is blood in the urine. And I'm not talking about obviously red urine here. Though, of course, if that happens, it requires an immediate medical exam. But here, I'm talking about hidden blood. Blood you can't see with the naked eye. Blood that only shows up in a laboratory urinalysis. We call this condition hematuria. Sometimes the patient sees their urine as red, pink, or light brown, and sometimes they don't see anything at all. And the blood appears, as we said, only in the urinalysis. That's the danger, because most people might say, I'm fine as long as the color is normal, but unfortunately, the analysis at that point says something else entirely. When the kidney filters are inflamed or damaged, they sometimes allow red blood cells to leak into the urine. But the blood in the urine doesn't just come from the kidneys. It could be a kidney stone, a urinary tract infection, or an enlarged prostate in men. And in some cases, it can be a sign of a tumor in the urinary tract. Finding blood in your urine, even just once, is something you shouldn't ignore, especially if it's painless. We made a very important episode on our channel about urology with Dr. Mohammed Salama, a consultant urologist. He explains this part in detail, covering the dangers of painless blood in the urine. If you're over 40 and a smoker, I highly recommend you watch this episode. I'll leave a link for it in the description or in the iCard. Let's continue. If you see blood in your urine, even just once, you must see your doctor immediately. And if you have risk factors like diabetes, high blood pressure, smoking, or a family history of kidney disease, ask your doctor about regular urine tests. A simple test can catch the problem before symptoms even appear. Sign number 4 doesn't happen during the day. It happens when your body is supposed to be resting. That's waking up frequently at night to use the bathroom, like 2, 3, or even 4 times a night. And this happens every single night. We call this condition nocturnal urination, or nocturia. Many people think this is just normal, especially as they get older. And honestly, sometimes there are simple reasons for it. For instance, you might have drunk too much water or had coffee or tea late in the evening. Or you might already have a prostate issue that's causing this to happen. Or perhaps you're taking a diuretic medication late in the day. But when it happens every night without an obvious cause, that's when you need to see a nephrologist. Healthy kidneys know how to concentrate urine while you sleep. What does that mean? It means they reduce the amount of urine your body produces so you can get 7 to 8 hours of solid sleep without having to get up every 2 hours. But when kidneys are affected, they lose that ability to concentrate. So the urine becomes very diluted and the volume increases. And you'll find yourself waking up constantly to go to the bathroom to empty all that urine. This symptom is really common in the early stages of certain kidney diseases. The problem isn't just the urination now. The real issue is this interrupted sleep. Broken sleep raises stress levels and affects blood sugar, leaving your entire body in a state of exhaustion. That's why frequent nighttime urination isn't just an annoyance, it's often a medical sign that needs to be checked out. If you're waking up more than once a night to use the bathroom, and it's not from drinking water before bed or a prostate issue, if you're a man, please ask your doctor for a kidney function test at your next visit. A urinalysis and a kidney function test. The final sign is quite strange because you don't see it, you smell it. The 5th and final sign is an unusually strong urine odor, a smell that's like pungent ammonia, or you could call it a foul odor that just won't go away. Let's be clear, the smelly urine can change for very simple reasons. Dehydration, for example, makes urine concentrated and it smells stronger. Some foods, like asparagus for instance, change the smell of urine. Some vitamins and supplements, even some medications, can change the smell of urine. These things are usually not serious. But when a smell is strong and persistent, even though you're drinking enough water and there's no obvious reason for it, that's when you need to pay attention. Sometimes a strong smell can be due to a urinary tract infection, especially if it's accompanied by burning, pain, fever, and frequent urination. And sometimes in advanced kidney patients, the buildup of certain waste products and toxins in the kidney, which they're unable to filter from the blood, like urea, for example. And when it's excreted, it comes out in a higher concentration in the urine, and that's what gives it a pungent smell similar to ammonia. A patient named Linda, 58 years old, told me, "Doctor, the smell of my urine changed 2 months ago. I thought it was just a simple infection, but the test showed a very high urea level, as well as a low filtration rate. The kidneys were struggling." So does this mean that every very strong urine smell, doctor, means the kidney is affected or that there's kidney disease? No, of course not. But a persistent smell, along with fatigue, swelling, nausea, loss of appetite, and a change in urine color or foaminess, these are a set of signs that you absolutely cannot ignore. Now that you know the 5 signs, what can you do with this information? Let me quickly review with you 5 signs your urine might reveal about your kidney health. The first sign is persistent foam. The second sign is dark colored urine that doesn't improve. The third sign is visible or hidden blood in the urine. The fourth sign is frequent nighttime urination. The fifth sign is an unusual and persistent urine smell. But here, I want you to listen to me carefully. I don't want you to be worried after watching this video. Worrying won't protect your kidneys. Correct information and early screening are what will save your kidneys. If you notice any of these signs, especially if they're persistent, ask your doctor about these 2 tests. The first test is a complete urinalysis. It detects protein, blood in the urine, infections, sugar, and other important things. It takes 2 minutes and is inexpensive, but it gives you a very early warning. The second test is a blood creatinine level test, along with calculating the filtration rate, which is GFR. This tells us how efficiently the kidneys are filtering the blood. These are the first 2 tests I order for all the patients who come to my clinic. And why is that? Because most kidney diseases are silent. Every day, you lose part of your kidney function without feeling any pain or any strange symptoms. But these urine and blood tests can detect the problem at a very early stage. And that's where it makes a big difference. Detecting the problem early helps us control blood pressure, manage blood sugar, reduce protein in the urine, avoid medications harmful to the kidneys, and protect the remaining kidney function. And if you want a simple step to start today to protect your kidneys, start drinking water. Not juices, not soft drinks, not energy drinks, not drinks full of sugar, just plain water. Your kidneys need water to function efficiently, but don't overdo it with water, because that's a misconception. Many people think it's good for your kidney health. A cup every 2 hours during the day is enough for most, unless your doctor says otherwise. Especially if you have kidney failure, are on dialysis, or have fluid retention. Your kidneys work in silence, but your urine is what speaks. Starting today, you should listen to it. And remember, we made this video today with good intentions. We also hope you've done something good today. Always make it a habit to like and share and help others. I'll see you next week to check in on you and reassure you. Don't forget to watch the video appearing on the screen now. A very important video about the effect of dehydration on kidney health. I highly recommend watching it, as it'll make a big difference for your kidneys. Go with God's grace.